But I just wanted to talk a little bit about how does South Carolina rank in domestic violence? Next slide. The Post and Courier actually did an article. It was a four-part series that was titled "Till Death Do Us Part," and it was published in 2015. In this article, okay, I almost cried reading it because a woman, okay, died in South Carolina by from somebody who supposedly loved her every 12 days. We had been ranked 49th or 50th for years. Next slide. So why is South Carolina so bad in domestic violence? You know, first of all, it's a very patriarchal society. You know, we're supposed to do what the man tells us, and we have more traditional gender roles, like, I mean, women cook more of the meals, that type of stuff, than other states. You know, we live in the Bible Belt, and we all know that Eve came from Adam's rib, and therefore we're forever indebted to the man for even creating us. Guns are much, you know, our Second Amendment in this state is like really strong. You know, most people want guns, they want them readily available, they want open carrier. And the other thing that I found just astounding, okay, just astounding, between 2008 to 2013, the funding for domestic violence victims actually came from marriage license, and they had collected $800,000 from 2008 to 2013. And so that was, they could spend $22 per domestic violence victim. I just thought that was amazing. Next slide. That's backwards. So Haley, there's a little something wrong with this. Let me see the next slide. Okay. So go back to that one. So this was on the front page of the Post and Courier. Haley worked to get $19 million more to hire more prosecutors, to focus on domestic violence cases. Actually, there were courts made for it, but on the same page, and there were people who actually voted against this. There was like 20 some House members who voted against this. There were less in the Senate, but in the House, how can you, when we have one woman dying every 12 days, vote against a bill to help us make that better? It just doesn't make any common sense. Okay. Now, on this same page, what they had voted almost unanimously on is limiting the time of alimony that a man would have to pay for a woman. Okay. So you can see the dichotomy in the thinking of the legislators just based on gender alone, how much they're willing to give things that benefit women and what they're willing to vote and do for in their own for their own pocketbook. The other thing is, I don't know why it just started echoing. But the other thing, and I totally forgot that, so we can go to the next slide. So under Haley's watch, we also got Domestic Violence Reform Act. It provided clear definitions. It also defined the degrees of violence, and it also recommended stronger punishments. Before this, the laws were based on a 1976 act, and like your first offense for domestic violence, regardless of the degree, was up to $1,000 fine. Or I mean, it was just something ridiculous. There was no prison sentence associated with it, like if you like broke a patient's bone or anything like this. But now there is more degrees of violence. And so the more physical the violence is, the stronger the punishment. Next slide. So we can get off the bottom, okay? And we can get off the top of the bad list, okay? This is an excellent example where we have done much better. So in 2020, South Carolina was out of the top 10 for women killed by domestic violence for the first time since 1996. Okay, and so we have done some good. Now, if you look at just the domestic violence numbers, we have moved from 50th to like, we're not out of the bottom 10 yet, but we're getting there. Okay, it's like 40, 41. Next slide, please. One of the things that we should advocate for, and I will tell y'all, I vote, it doesn't really matter to me the party, but it matters to me their stands, and it matters to me their understanding of certain healthcare issues. We have criminal domestic violence courts. We need more of them because they need to be supported by law enforcement, judges, prosecutors, mental health professions, victim advocates. And the goal of these courts is to improve the safety for the victims and hold the offenders accountable. If you have been abused as a child or seen your mother or your father abused, you are much, much more likely to abuse your intimate partner than if you never saw that. So we have to work to break the cycle, and mental health professions, classes for the perpetrators are important for this. So just when you're talking about to politicians and you're trying to figure out who to vote for, ask where they stand on some of these essential positions for our patients. Next slide. That's it. I'll get off my soapbox now.
Donna, that was great. I think that it's an area that we don't ask enough. It's just like depression. We don't ask the questions, and if we don't ask the questions, we're not going to get the answer. This is a little bit different because so often they're still very secretive and don't want to share the information. But the more that we show that we're interested, the more likely they are to share. I guess a question, just a matter of how to do this, because we do see this, and my nurses ask me often. I'm just curious to see how you'll respond. But you have a couple come in, and the suspicion is high that he is overbearing and will not leave her alone with anybody in the office. do you have any tricks that you suggest to your staff, and how can you help get them separate? I thought that story with you whispering in her ear was poignant and important, I think, to take that upon yourself to do that. But are there other ways that we can that we may be able to get that patient free from her potential abusive partner to talk to us?
So the one place that they don't usually go to is the bathroom. Okay. And on the back of a bathroom door, you can actually leave something to say, if you need help, write help on the board or tear a piece of paper off and write help on it. That was probably the best thing I saw to actually be able to isolate the victim from their perpetrator.
Dr. Johnson, this is Cheryl, and we're doing work with human trafficking victims, and there is some crossover with this. And a couple of the suggestions that have been made is for facilities to have a little sticker available in the bathroom, and they can just pull that sticker off and put it on the bottom of their urine cup. And then the staff looks at the bottom of the urine cup, and that's their little, quiet way of saying, I need help, there's been other things I've seen on the internet with placing an X on something. So there's a myriad of different ways that someone in danger or in trouble can notify the healthcare provider so that they can hopefully intervene for them. I wanted to ask if you talked about strangulation injuries. I wasn't on the very beginning of the call.
No, you can actually email me, Cheryl, and I'll be happy to. But Dr. Clara Smith from our Women's Reproductive Health is with us, and she wanted to say a few things.
Hey, that was Rachel who sent that to the group. I have a patient at 1 p.m., so I'm going to have to hop off in just a second. But is there, Rachel, is there something specific that I can speak to?
Yeah, if you could speak to what actions providers or anyone on the call could take to help identify women who may be at risk. What are some things that one can do in the office?
I mean, I think that a lot of what's been talked about is going to be the same in our clinic and in all clinics, that there's a lot of challenges in getting people to report accurately and to disclose. I think maintaining a relationship and encouraging attendance to in our case, to all the appointments and things like that will create an alliance that then they will be more likely to disclose. But at MUSC, in trying to navigate this issue with the, a lot of times the screening questions are phrased like, you're not depressed, are you? Not feeling unsafe at home, are you? Those types of sort of close-ended, implying that you shouldn't be feeling depressed, you shouldn't be feeling unsafe. And so certainly the more open-ended questions, but what we've done, because we also have found that those aren't effective at rooting out any issues, is created a text message screening program that women are enrolled in, and they get a series of screening questions, very general. I believe it's 7 or 9 screening questions that range from substance use, mood, anxiety, and safety at home. And they get that repeatedly throughout their pregnancy and their postpartum period. And that goes to our care coordinator with any positive screen, and we can reach out to them. So a little bit less intimidating, I think, is, answering a text message, but that's just an anecdotal example of something that we've done to try and increase the positive reporting on their end. But I'm sorry, I have to jump off. My doxy patient is here. So I will, anybody's welcome to email or us and find out about our services or anything that we can do to help.
Thank you so much, Dr. Smith. And I know, Edwina, are you still on the call?
Yes. I just had a question about, are there any programs anyone know of to help the men that inflict the domestic violence, because if that woman leaves him, his next partner is going to be the next victim. And so there's something wrong with these men that it seems like we need to have some type of program to help them with whatever is causing them to inflict pain on women.
So there are some anger management resources. And that, you know, the court system, where the domestic violence court system, they actually have some resources for the perpetrator. Okay. And they, if it goes to court, they can make the person follow up. But if they don't, I do know that there are some classes, and your social worker in your hospital should know something about that. I actually will ask Kelly Finke, what are the classes and where we can find them.
Thank you.
We also have a message saying that Compass of Carolina in Greenville is a resource for perpetrators. They also provide victims education, etc. also. All right.
Great topic, hard topic, and I thought you did a great job with that, Donna. Thank you so much.
Barry, I don't know. It took me a lot of work.
It's tough. It's a tough one, and I think the key from all this, I think, is just we need to ask the questions. We
Yes.
just need to ask the questions. Thank you so much, everybody, for participating today.
Bye-bye.